The Life Esidimeni matter, as we have since learned that a judgment has been made. We bringing in now Director at the South African Depression and Anxiety Group, Cassey Chambers, to bring us some reaction there. Cassey, very good evening to you. Thank you so much for your time. I mean, I was looking at you as we played the story with the reaction from some of the families affected by the tragedy of Life Esidimeni. I know you have been a big part of it and trying to ensure justice for these families and the patients which family members have unfortunately lost. What is your reaction to this judgment?
I think for us, we're looking back after 8 years where we fought and we've gone through so many different processes. To be at the place that we are today and to get that judgment just feels so vindicating, that everything that we've done and all the years and the work, and it's just that someone has listened and someone has said yes, that these people are responsible. For so long we were waiting for some kind of direction or guidance and I think answers as to what had happened. And I think today we got some of those answers and definitely a way forward. We've been dealing with so much, and I think just watching the family members and their responses, it has been such an emotional roller coaster. After 8 years, there's still so much grief and pain and frustration and anger. And these are loved ones, even those that the judge, named by names, and you had heard their ages and how they died. It reminds us that these were people, these were patients, these were our brothers and sisters and aunts and uncles, and they had stories. And I think today it just really says that their deaths were not in vain, and that this is really a momentous occasion in the mental health landscape. And I think going forward is something that we're going to be monitoring really, really closely.
Yeah. As a civil society organization that was amongst those who sounded the alarm that, patients with mental illnesses would be at risk, when you look back to when the news first broke on the 26th of March 2016 that someone had died, what stands out for you as you talk about the long road and some of the challenges that took place?
Absolutely. I remember exactly where we were when we heard of the first death, and we were all together as families actually at a protest at the Gauteng Department of Health buildings when we got the first reports. And I think it was incredibly huge knock. It was just after we had gone to court to prevent the movement of patients to an NGO, Qedhani in Soweto. And I think for us it was a huge disappointment that we were already not heard. And then, as we know from the recordings and the statements and what happened after that, is that there were so many more deaths that were reported, in which every single one, we had spoken to families, we had heard their pain. And I think the anxiety and the trauma and the grief is something that will be with us for a very long time. We heard the voices, we had the stories, we had tracked this with families, and I think it was incredibly devastating. And as we had gone through the various different investigations and Ombuds investigation, to learn that the deaths were not just one, but at that stage 36, and then even further over 100. So it's been incredibly hard. And I think what really stood out for me today when Judge Teffo also just said that the two held responsible, that if they had listened and acted differently, that they could have prevented the death from happening, and that we could have saved those lives. And I think, we tried so hard in so many different ways to sound the alarm, to get them to stop the discharge. And I think that was really hard. So today it's bittersweet, because there's a lot of vindication, a lot of relief from today. But we also have to remember that there were 144 lives lost. And it's the idea now of, what if they listened? What if they did something different? We wouldn't be there. But today it's bittersweet, and at least we have some relief. We've got some answers, and now we can take those next steps together.
Yeah, with some relief and some answers. We also know that the NPA is expected to decide whether or not to pursue criminal prosecutions. In the quest for justice, would you say that you would like to see a call for criminal culpability for their conduct?
I think we have enough information from today that says that these two people are responsible for those deaths. And even though 9 patients were mentioned, we know that there were 144 connected deaths. So for us, I think justice, and for a lot of the families, is to say that their deaths were not in vain and that someone has to be held accountable. And I think those would be the next steps. The families would be engaging with the legal teams, and we will be there, civil society, to support them. You know, we've been through such a journey over the last 8 years, and we're not going to give up. And I think it also sets a precedent that we cannot ignore the mental health rights of patients living with a mental illness, the most vulnerable group of people. And I think those would be those next steps that the families would be able to pursue. But us as civil societies, we cannot forget what has happened. We have to seek justice, and we have to seek further answers to make sure that this kind of thing never happens again.
Yeah. Just last week, we heard Gauteng Premier Panyaza Lesufi apologizing to NGOs for the recent non-payment of subsidies and funding to the sector. He even went as far as admitting that there were serious missteps which needed to be rectified, also noting that the government needed to duplicate the work of NGOs and so forth. How significant is such a commitment as we take stock of the role of NGOs, the challenges NGOs face, and the gaps that they're able to fill?
Exactly that. You know, NGOs are doing so much work on the ground, and they're at the coalface, and they're there to fill the gap that's between people who are suffering or dealing with so many different issues and versus what we're not finding that the government is able to provide. So there should be a conjunction, a collaboration. But we know how incredibly difficult it is for these NGOs to do this important work with no resources. To hear the devastating news that NGOs that have been around for 30, 60, 70 years have had to close their doors and turn patients away, turn children away. It's devastating. These were organizations that have been such a groundwork for South Africa, and now just because of funding, they're closed. And I think that's incredibly hard. There are so many amazing people that work at these NGOs and have worked for many years that are now unemployed, and people that relied on their services that now have to seek elsewhere. So it's incredibly important and a pivotal moment in our government from a national and a provincial level in prioritizing funding to NGOs who are doing the most important work on the ground and can have all the records and agreements in place. And I think this is where we really have to put pressure on as civil society to say that the work that NGOs do is incredibly important and should be funded and supported by provincial and national governments. We shouldn't be seeing that NGOs are having to go to court to pursue their funding that was promised in an agreements and contracts. This shouldn't be the case. And I think it has a profound impact on people in the community. And I think this is where we really have to look at is from a budgeting perspective, is that we have to invest more in NGOs, especially work in the ground. And even further, just looking at mental health and the state of mental health, we have to look at investing more into mental health. We have to improve the services. Because while we're talking about the 144 lives that were lost in the Life Esidimeni tragedy, there were so many hundreds more that survived that marathon project and are still living in NGOs and homes in and around Gauteng. Yeah. But there's also a lot of patients who even are accessing care today, tomorrow, and even next week. And we have to ensure that they do have access to quality treatment and care. So we have to do better, and we have to improve the mental health services, not just in Gauteng, but in South Africa.
What are some of the very important lessons, do you think, came out of such an unfortunate event?
I think one of the landmark collaborations for us as an NGO dealing with mental health is we could not have done this alone. It shows true partnership and collaboration that us as SADAG can partner with organizations like the South African Society of Psychiatrists, SASOP, as well as Section 27, and even the Life Esidimeni Family Committee, who really all came together and made sure that we fought this for the last 8 years and going forward. I think it just shows that from all these different sectors and groups is that we can work together and we can make sure that there's a difference that is made. So I think for us, that's a big learning curve. I think we have to really take in what the written judgment and those findings are and say, well, how do we use this going forward? At think one of the big learnings we would like to see, especially now with the new national government and ministers and executive that's in place, as well as at a provincial level, is that we have to learn so much from Life Esidimeni and make sure that the government officials and decision makers and policy makers are learning from this, so that we can make sure that we're doing better for mental health, so that we never have to deal with another Life Esidimeni in any of our lifetimes. We've used the slogan throughout of, never forget. And I think that we're having to remind ourselves every day that we need to do better, because if we don't invest in mental health, it can have very fatal consequences. And that's what we're wanting to avoid going forward.